Iñaki, it's such a pleasure to have you here. This is our last session, so let's enjoy it. Iñaki, there's so many questions I have about you. I think when I was doing my research, I was so impressed by your background. I know you come from a small village near Alicante, right? So you're Spanish, but you've lived abroad, and you've done so many different things, which is why I guess the name serial entrepreneur. But we're here to talk about AI, right? And so one of the things that I know you said recently as well is that there is so much potential with AI, and there's also so much untapped value creation in the healthcare space leveraging AI. And so I'm personally interested, why do you say that? You also said that this field has the most potential for unicorn creation. So I want to hear more about what got you into this health and AI space, and why you think this is such a potent field.
Well, first of all, thank you for having me here. As you know, I went to UPV, like Technical University of Valencia, to study my undergrad, and then I went abroad to do my PhD, and then I stayed in the US building technology companies, and now I'm an investor. And to your question, why I'm excited about AI applied to health, I think that I'm excited in general about AI. AI as a horizontal technology that can reinvent every single industry. And this revolution is going to be bigger than mobile, internet, crypto, cloud, you name it. It's going to change how we think, how we work, how we organize ourselves, and how we create. And especially in professions where there is a shortage, think about doctors, nurses, drivers, lawyers, teachers. So we are going to enter in an age of abundance because AI is going to create infinite capacity, because the work of many of those professions are going to be enhanced by GPUs from NVIDIA. So I could be excited about any single industry, but why in particular healthcare? Many reasons. One is, it is exciting when you are an entrepreneur to help save lives. So everyone would like to be a doctor, right? Like with their friends, or work in pharma. The second thing is that it's one of the largest industries in the economy. In the US, it's about 20% of the total economy, of the GDP. In Europe, it's a little bit more than 10% of the total economy. The second thing is that it is digitized already. If you think about healthcare, biology, chemistry, it is all about zeros and one, but the information is not structured, it is scattered, and this is the perfect application for AI. If you think about a good application for ChatGPT or OpenAI or Anthropic, is about aggregating information with different structures. If you think about healthcare, it could be genomics, blood tests, images like MRIs and CT scans, and AI is very good at aggregating that information and making sense out of that. And the thing that I'm very excited about during the last 2 or 3 years is that, what you were saying, that nobody would have predicted what is the industry that is going to be adopting AI faster. But if you look at 2024, the industry that spent more money on AI is healthcare, twice as much as banking or insurance. So yeah, like the revolution is coming to healthcare.
But I'm going to step in there, actually. This is a really interesting finding, because there's also been statistics around how healthcare is actually still a really underdeveloped field when it comes to AI adoption. So what do you have to say about that? So there is this potential, but adoption is still relatively low in healthcare in comparison to other industries.
Actually, that surprisingly, that is changing, right? Like if you think about the US, there are 2 applications of AI that are already deployed in more than 50% of the hospitals and the doctors. One is medical scribes. So until 2 years ago, if you were going to a doctor, either in Spain or in the US, the doctor would be talking to you, and at the end of that visit, would need to write down the notes of the visit. So that is now done in more than 50% of the hospitals by AI. So there is a microphone records the conversation, transcribes that, and summarizes that in the EHRs, the medical records, exactly with the structure or the template of the medical record. That has many implications. First, the doctor can show more empathy, doesn't have to be typing down on the computer, can be looking at the eyes of the patient. The other thing is that you are going to be aggregating richer information because doctors in the end, they just take one line of notes or 2 lines of notes. And the third thing is that the doctor can spend more time talking to the patient. So that is number one. Another one is a company, for example, called Open Evidence, like OpenAI, but Open Evidence. Launched less than 2 years ago. Now it is used by more than 50% of all the doctors in the US. It is free for the doctors. It's like a ChatGPT trained with medical studies. So when the doctor has to decide what recommendation to give to a patient for something that is not that common, instead of going to ChatGPT, that I'm sure that we all go to ChatGPT, Open Evidence is very good at citing other studies from top journals in medicine, so they have the most recent information, and then you see the citations there, the references of what you are recommending. So actually it is being adopted very quickly, and actually there is, like, some people are underestimating how good AI is in healthcare. Like, I'm going to give you like a couple of examples. One is, like, there was a study 2 years ago done with the general population, either working in healthcare or general population, and people would say, like, well, AI would never be as good as doctors, and even if they are good at like doctors in terms of content, there are 2 things that doctors have that AI will never have. One is empathy. So in the end, like, people that study medicine is a very vocational profession. So showing empathy with patients, that AI will never have. And the second thing is explaining things in simple terms so the patient can understand what is going on with them. They did a study with voice conversations between doctors and patients. The patients didn't know that they were talking to a AI voice agent, because now you know that voices are hyper-realistic. And like 100 cases, there were like regular doctors. In another 100 cases, there were AI voice agents trained with medical data. And at the end of the visit or the telephone conversation, they were asking who showed more empathy and did you understand properly what they explained that is going on with you? And guess what, right? Like, AI voice agents were
I was
much
going
better.
to say,
Yeah.
it's funny because I've actually asked ChatGPT stuff about health.
Actually, like 10% of the consultations or the prompts on ChatGPT are about healthcare.
10%?
10%.
Okay, pretty interesting. I mean, this is really exciting, right? And there's so many things that come to mind when I hear that, but I'm looking at the time and I'm like, oh, where can we go with this? Because I think with AI, especially in healthcare, it's such a highly regulated field, especially in Europe, right? You gave some examples about the US and how doctors there, or 50% of clinics are already using open evidence, right?
Free for them, free for the doctors, and then there is advertising on the side, yeah.
So that's in the US, but what about in Europe, right? If you compare these ecosystems, what are we going to do with bringing these kinds of technologies to the healthcare space in Europe and balancing all these regulatory kind of barriers that I think are keeping a lot of people on, like on the fence about going there?
Let me talk about a couple of things. One is the fast adoption of new technologies in the US versus Europe. In Europe, healthcare is primarily public. So yes, of course, you have private health insurance, but that is just marginal compared to the overall healthcare industry. When you are trying to adopt solutions and you are the government, you cannot just pick someone because you think that is the best. You have to follow a process. You have to do a concurso, or I don't know how you call that, but basically many people have to apply with certain norms of how you are going to pick the winner. That takes time. The second thing is that many of the improvements that are happening in the US are operational. So don't forget that the high cost of healthcare is not high salaries of doctors or nurses or machines. If you enter in a hospital, more than 50% of the people working in a hospital are not doctors, are not nurses, are back office people. So if you adopt AI to be more efficient operationally, all those savings can be spent with additional doctors. So it's the indirect or the second derivative or second order effect of saving in operational costs that is 50% of the cost of running a hospital. So those savings will go into better healthcare, but people in the US, they do that mainly because they want to save costs, because it's a private company and it is for profit. So that is number one. Number two is that in general, like everyone is going to benefit from healthcare. So you're saying like, are we going to fall behind or not behind? From a consumer surplus, yeah, it may take 1 year, may take 2 years or 3-year delays. Many technologies take a little bit longer in Europe than in the US. Self-driving cars, like now if you go to San Francisco, Austin, LA, you can use Waymo, but you cannot use that in any country in Europe. It's not about Spain, it's like including UK. So things arrive here a little bit later, but in the end, everyone is going to benefit. So ChatGPT, like the ChatGPT that people use in the UK or in Switzerland or in Spain or in Singapore is the same one. So from a consumer surplus, everyone is going to benefit. The big difference is where wealth is being created, and that wealth is being created mainly in Silicon Valley, right? But the benefits are distributed across the world.
You know, earlier I was making a joke how I heard somebody say to me recently, yeah, you know, you've got Silicon Valley, that's where innovation happens. But in Europe, we've got the Silicon Valley of regulation. And I thought that was really funny. One of the things I'd like to talk about a little bit more is, so you gave some examples in you know, where AI can add value in healthcare. So if you think about the next 5 years, next 10 years or so, I know you are really, really good at anticipating trends. It's one of your strengths, and that's probably why you've become so successful. What do you think in terms of new trends when it comes to AI in healthcare? What's going to surprise us?
I think that it follows the trajectory of AI becoming more powerful and trying to understand more complex situations. That is not only about healthcare, it's about every single industry. One is robotics. So what OpenAI has done for the digital world, who is going to be building that for the real world? 3D environments with more degrees of uncertainty, and it is much more complex work. But there are many companies building AI robots for many things. How do you apply that to healthcare? And how do you create abundance thanks to AI in robotics in healthcare? So one is surgical robotics. So today, if you want to have a breast surgery because you have cancer, like you can have a surgeon that is doing a minimally invasive surgery, but in the end, it's very subjective to the human of where they have to cut, for example. We have invested in a company that is doing this in the UK. So deciding where you see an organ or a tissue and decide whether you cut here or you cut a little bit more to the right or to the left is very subjective. Of course, there is like the lighting and you have the colors, but in the end, it's a little bit up to the best practices of the doctors and the experience of the doctor. Very soon, this is going to be like self-driving cars. Like with the cameras that you have, hyperspectral cameras, you are going to, like the robot is going to decide, like in a car, like whether you accelerate, you brake, you turn left, you turn right. Like a robot doing surgery is going to be exactly the same. And this is going to be a step by step. Now in many hospitals, you have the Da Vinci robots. Probably you have heard of them, $3 or $4 million. But still, there is a human operating that with a joystick behind the room. So, but it's not fully autonomous. It's almost like cars that now when you buy a new car, it has a lot of sensors. So before you are going to push or like you're going to hit a wall, it breaks, but you are still in control. But very soon, like Tesla is going to allow everyone, you still have to be there, and very soon, like the robotaxis from Tesla, you don't need to be sitting there, right? So this is going to happen in robots for surgery. So everyone is going to have the best surgeon in the world helping them to do any type of surgery, no matter whether you are in the best clinic in the US or in the best clinic or in an average clinic in Rwanda, right?
Iñaki, you mentioned that you have invested in a UK business that leverages AI to help with the breast surgery, right? In the last few minutes, would you be able to tell us a little bit more about what you're investing in the AI and health space? Just a couple of examples, and also what you look for as an investor.
Yeah.
What are your green flags and what are the red flags?
Yeah. So maybe the second one is better, right? What we look for, like, as you know, I'm a partner in a fund, LifeX, that we invest in the intersection of AI and healthcare. Maybe we have time, I also talk a little bit about something new that I'm starting in parallel to my role of an investor. But what we look for is like what VCs look for, is market, team, and product. A market has to be a very large market that is undergoing a paradigm shift, either because it is being created and will be very big soon, or it is already very big and is going to change who's controlling that market. The second thing is the team, and in the early stages, the team is the founding team mainly. And the third thing is the idea. But in AI, there is something that makes startups very special, that is if they can grow revenues very quickly. That is very different to what was happening in technology 5 years ago or 10 years ago. Now you're seeing AI companies that in 2 years or in 3 years, they have 10 million in revenues, 20 million in revenues, 30 million in revenues. And it's not only about the OpenAIs and Anthropic. Companies that raise very little, that they get to 10 million or 20 million in revenues very quickly, the main reason is that they don't go, when they sell to businesses, they don't go after the IT budget, so they go after the human resources budget. So they are trying to replace humans with AI, and that means that even if you have a small business buying your product and that company has 100 employees, that company can be paying like $1 million a year for your product because you are replacing many of those people. That, by the way, that is another problem that you have to fix in society, what you are going to do with all these people that are going to be losing their jobs. But if you go after the HR budget, where people were making 30,000 euros a year, 40,000 euros a year, you sell that solution for 10,000, but the quality is better, the productivity is better, the deployment is better, you can work 24/7, and that is happening in call centers, in driving, in operations, in back office and administrative jobs, and so on. So that is something that I look for, and in terms of healthcare, it could be front office and back office. Front office is anything that you can do with AI for better prevention, diagnostics before you even have symptoms, and better monitoring without using humans, so everything with AI. And the back office is all the inefficiencies that you have in the healthcare system, that like, you have a lot of administrative work when it comes to healthcare.
So good market, good team, good idea, in that order.
Yeah, but the most important thing is that you go after the HR budget and not the IT budget.
Okay. Iñaki, we are really running out of time, so I'm going to have to give you the elevator pitch of 20, 30 seconds of what you wanted to say about what you're doing next, some future. You mentioned you wanted to share something, but we have to be really quick because these guys are waiting to come on stage.
Just speak, write the next wave of innovation. Like if I was starting a company 3 years ago, it would be like models. Like 2 years ago, it would be AI voice agents and general agents. This year is more of agents, but next year could be video and content creation. So I probably have seen the videos from Sora that can have many applications in many industries. So try to catch the wave at the beginning of the inflection point.
I wish I could talk to you more. This is so interesting. Thank you so much for your time. Enjoy the rest of the day, and thanks, Iñaki Berenguer.
Thank you for having me.
Thank you.